Okay, today, as you saw during his meeting with CEOs and labor leaders to discuss the importance of passing the CHIPS Act, the president is doing quite well and continues to be engaged in the important work in front of him. You might have heard a little hoarseness in his voice, which Dr. O'Connor mentioned is one of the few residual symptoms remaining, but I can tell you he was excited to discuss the issue and was also excited to take some questions from you guys today. As you know, Dr. O'Connor provided another update on President Biden's health, indicating that he is doing quite well, which you were able to see for yourself just now. And he continues to respond well to Paxlovid after his 4th day of treatment last night. As we have said, almost everyone is going to get COVID, and because of the hard work we have done since day one, turning around the disjointed COVID response we inherited, we have the tools to ensure that people can go about their daily life and work. The president is fully vaccinated, twice boosted, and is taking Paxlovid. His current health speaks to how Americans should avail themselves of boosters and treatments. I'm going to hand it over now to Dr. Jha, who has some updates. I don't want to get ahead of him on COVID and the administration's effort to aggressively combat monkeypox and protect communities from the virus. He's gonna have an opening. We're gonna keep him from 15, 20 minutes to take your questions, and then I know there are other topics that you all want to touch on, and then we'll continue with the briefing. All right, go ahead, Dr. Jha.
Thank you. All right, good afternoon, everybody. So I'm pleased to be with you again today. As Karine mentioned, the president continues to do well. He was feeling good this weekend. He continues to improve. And before I open up to questions, and again, you all had a chance to see him, many of you had a chance to ask him questions, I want to give you an update on both COVID-19 and monkeypox. So let's talk a little bit about COVID. I want to start by emphasizing the importance of staying up to date on COVID-19 vaccinations as we face BA.5. Approximately 400 Americans are still dying every day, which, while much better than it was when the president took office, is still too many, still too high, particularly because we can now prevent most of these deaths. Our existing vaccines continue to provide robust protection against serious illness, hospitalizations, and deaths. And because protection wanes over time, it is crucial for people to get a booster to stay up to date. Most deaths are happening in people who are not up to date on their vaccines. Let me repeat that. Most deaths are happening in people who are not up to date with their vaccines. And it is critical that people get out and get vaccinated. As I have said this, and as I've said before, and I will say again, if you're over 50 or moderately or severely immunocompromised, but if you're over 50 and haven't gotten a vaccine this year in the year 2022, you should get one right away. I would not wait. Now, looking ahead, we know this virus is constantly evolving, and we can't be complacent. And we are in the much better situation that we are in today because we have been aggressive and forward-leaning in our approach, and we will continue doing that. And to that end, tomorrow, we will be hosting the White House Summit on the future of COVID-19 vaccines. There's a lot of work happening inside the U.S. government and in private industry on the true next generation of COVID-19 vaccines. And the summit will feature some of the cutting-edge work being done by U.S. government scientists, scientists in the private sector, companies, American companies who are working on these issues. This summit is an opportunity to bring people together to showcase the science that is already happening, to highlight the work of this administration and what it is doing to bring about these advances for the American people.